Well, this is a great question because I get asked this by my patients all the time, mostly because people hear about cannabis and glaucoma so much that they're genuinely curious about how cannabis affects glaucoma. Well, the short answer is that it's not a treatment for glaucoma, and here's why. There are so many different ways of using cannabis or pot that the absorption and the effect of the eye is so varied and unreliable. For example, if someone, eats a cannabis brownie, the absorption of the drug from the intestinal system can be super variable from person to person. So we don't really know how much is getting to the eye. Secondly, in order for cannabis to be effective in treating intraocular pressure, you actually have to use it all the time. So I jokingly tell my patients, sure, you can treat your glaucoma with pot if you want to smoke a joint every 3 hours. And that usually gets a laugh, but it makes the point that the medications and our other treatments for glaucoma are predictable, reliable, and well studied, whereas cannabis for glaucoma is unpredictable, unreliable, and you have to use it all the time because it's usually short acting. It's a little bit similar to scotch. I tell my patients, if you drink a stiff drink, it will also lower your intraocular pressure, but I would never tell you to drink scotch all day long. So many of the mood altering drugs that are available will temporarily lower pressure, but aren't a reasonable treatment for glaucoma and can even harm you. Whereas our medications are well studied, we know how they work, they're safe and effective with a dose once or twice a day in lowering your pressure.